Hi, my name is Abby LeMay West. I'm from Lincoln, Vermont. Honorable representatives and senators, Vermont's passage of Act 48 proves what we already know. Healthcare is a human right. We know that it is the just, moral, and right thing to do, and that it is the living embodiment of Vermont values. We know the failings of healthcare in the U.S., and we know the costs and benefits and the economic return on investment for universal primary care. So I will not repeat them here, but I will speak for those who cannot be here. For hardworking Vermonters who own small businesses, work tirelessly on their farms, or who scrape by working 2 or 3 jobs. For my sister who has bipolar disorder, who must have treatment to stay healthy and to stay working, who has earned her college degree, works full-time, and yet can't find permanent work that provides health benefits. For my mother whose chronic and disabling disorder forced her to retire early, losing her health insurance and her income. For my cousin who fell on ice just last week and severely injured her shoulder, who is not getting the doctor-recommended MRI because she's being laid off in 2 weeks and won't be able to afford it without insurance. For my dear friend who is a nurse who, as she got closer to retirement age, could no longer work the demanding hours of a full-time hospital floor. She retired early, losing her health care. She still works per diem 3 to 4 days a week, and her husband works as a handyman. They don't have health insurance because they can't afford the $1,000 a month premium and $13,000 a year deductible. They would have to spend $25,000 a year to get a penny in coverage. Health insurance does not mean equal access to health care. For my friend who thought he just had a bad chest cold, who didn't go to a doctor because he couldn't afford it, who finally decided it was bad enough to go to the ER, where he was diagnosed with pneumonia and died within 24 hours of admission. He died. He died because he couldn't afford to see his primary doctor. That is the one and only reason. He died because the foundation of our healthcare depends on corporate insurance companies whose legal mandate is to make profit for its shareholders. They have a vested interest in people living shorter lives and not insuring the elderly, sick, and infirmed, and in paying the least possible amount to service providers. These profiteers hold our lives ransom. It is repugnant. And we all know these stories. We hear them all the time. We are living and dying in this reality every day. Every single day, our families suffer, our friends die because they can't afford to see a doctor. Life or death should not depend on dollars, and it is within your capacity to fix this. I urge you to remember that we are not just numbers on an insurance company's bottom line. We are not year-end profits that buy someone a second home. We are not bodies to be managed by insurance companies as a source of profit. We are people, living beings who suffer unnecessarily and die for no reason. And it is time for Vermont to stand up for Vermonters and to do what is right and just to move forward with universal primary care.